Equally, you undertake immunization of children. But the question would be, do we have laboratories in these health centers? So these are some of the areas that we need to be looking at, the loopholes, where we have challenges, and saying let's divert money into primary health to ensure that we achieve this objective of ensuring that we have a universal health care. Right. If you look at the primary health, government is supposed to put in money there about 8 billion. Then the critical...
The budgeting is 54. It's only 8 that has been allocated so far. But what's required is 54 billion Kenya shillings.
Yes, but they are allocating 8 billion as a start because you have to stagger. Okay. Because we need money in several other areas. You look at the critical health.
All right, Charles, let's take a look at the arrival of the Deputy President, Professor Abraham Kithure Kindiki. And that's one of my former colleague, Hassan Mugambi there, who works with the Environment Minister, Adan Duale there. Yeah. Part of his job continues to be a journalist, as ever, Hassan there. This is Professor Abraham Kithure Kindiki, the Deputy President, who is being received by Nairobi County Governor Johnson Sakaja. It then means any moment from now, the head of state will be here. And protocol-wise then means the head of state is what in technical terms is said to be in motion. He must have left State House.
Just close by.
Any minute from now, he will be here. Yes, Charles, finish up.
Yeah, so what I was saying is that an undertaking like the health docket, you know very well that we have tried bringing in universal health care since the year 2000, and the president has decided to bite the bullet. I know there will be challenges, but this is a subject that we really need to support by all means to ensure that we succeed. Hashi, I would not want you to look at the universal health care as shit. I want us to, the way we are debating objectively, to look at what is the best way possible that we can make use, we can develop this healthcare so that each and every person...
Are you about, perhaps as we move close to the tail end of this, as we work this program, I would say that the innovators of tomorrow, the educators of tomorrow, and even the health workers of tomorrow are going to be incubated by what we're doing today through policies, through management of institutions. It is a pity, for example, that we've got public universities such as Moi University going down. It needs to be salvaged. We need not tinker with education. We need not tinker with health. And the policies, for example, in terms of the education model, when you look at even the healthcare system or framework that has been proposed by the president, I think these are well-intentioned. We need to make sure that systems that are supposed to implement these are rid of corruption. Actually, we must reject and curse corruption by all means. And all of us here agree, and even Professor Adams, Professor Martin Olo here agrees with me.
But when you start with a you found this social health care program on corruption of 104 billion with a procurement that is not known anywhere.
We don't know the service providers
and
yet.
we don't know the service provider, and we don't know who the face...
and that's why I think,
when you found
as Hawk-eyed Kenyans,
it can only be corruption.
We must